You're up. Oh, I'm sorry.
I stole your lines yesterday.
Talking. Imagine a knee replacement procedure that reduces recovery time, walking the same day even.
I mean, that's really amazing to think about. And it's actually happening in your community. Muthana Sartawi is the orthopedic surgeon and chair for the Department of Orthopedics at Christie Clinic. It's good to have you.
Thank you. It's good to be here.
So we were really excited to hear a little bit more about the background for this and how you developed these procedures. So tell us a little bit about that.
Yeah, so the traditional technique used in knee replacements requires the surgeon to cut the main muscle and tendon when performing a knee replacement.
And where is that on the knee?
This is basically a quadriceps tendon, which is right here in the front of the knee.
Okay.
Typically, I mean, this is a good approach. It gives the surgeon excellent exposure to place the components in the correct orientation. However, it's been studied and shown it delays early recovery in terms of straight leg raise and ambulation on the day of surgery. So the technique we've developed preserves all the tendons and muscles around the knee, yet still gives the surgeon the same excellent exposure to put the components in the correct position.
And so that's also going to shorten recovery time.
Exactly.
Really? They're going to be up walking that same day?
Yes, yes. Fortunately, the majority of our patients, if not all, are up the same day of surgery and can go home the same day of surgery.
Wow.
That's really amazing.
That's impressive.
And the proof that this is actually being used are some of the rather impressive clientele that you've had engage your services.
So some royals and some dignitaries from overseas. How
Yes.
did they learn about you?
Well, there were some interviews that have been aired on Middle Eastern media, such as Al Jazeera TV and on Al Arabiya, and ever since, patients have been contacting me and flying actually from the Middle East to Dubai, Saudi, Qatar, Doha, to Champaign, Illinois.
Well, that says a lot about this procedure and how special it is to, have it here in Central Illinois.
Correct, yes. And patients here can basically have this under insurance. Most of these patients who are coming overseas are paying out of pocket, but here we offer it to the community at the same insurance.
Yeah.
So who would be a good candidate for this surgery? I'm sure there's different cases.
Correct. Pretty much any patient that's indicated for a knee replacement is a good candidate for this procedure. There are a certain group of patients, such as morbidly obese patients or diabetics who have uncontrolled diabetes, that are at higher risk of complications, whether with this technique or any other knee replacement procedure.
So what's the difference between this? I mean, you were kind of talking a little bit about that with the traditional knee replacement. So this improves recovery time.
Correct.
And at the end of the day, I'm sure people want to know, does it improve your overall recovery? Because even if it takes longer and you get far, that's okay. But this does both?
Yes, exactly. Because the first few weeks after surgery, your range of motion, your strengthening influences the longevity of how you perform with your knee replacement. And therefore, since early these patients are having minimal pain, are able to walk and perform very well with physical therapy, do their exercises, they actually do very well in the long term.
We're looking at some video now, so kind of walk us through what we're looking at.
This is the quadriceps tendon that you had mentioned.
Exactly. So the traditional approach cuts that quadriceps tendon. There's another approach that cuts the vastus medialis muscle. Those are, I'd say, the most commonly used approaches today. And the technique we've developed preserves all these muscles and tendons.
I know when my husband had some surgery done on his leg, he was given a nerve block.
Yes.
Is that something that you also do with this procedure?
A lot of surgeons do that. However, with this technique and the program that we've developed, we did not see the need to do so.
Oh, look at that. Minutes after surgery. That's crazy.
So this is the typical clinical outcome we see. This is a patient hours after surgery, as you can see, walking unassisted, comfortably,
briskly even,
without a limp. And even the physical therapy team can't, and he's trying to run. And
you don't advise running, right?
No, I don't, but I think he was trying to show off there, which is fine.
Now, watching him do that is so impressive, but is he going to be hurting like later after being, this, vigorous with
That's a good question. I tell him to take it easy because it can swell up, but as long as you follow the instructions, you should be okay. This is another patient from Saudi Arabia who is getting dressed, and he's dressed and ready to go home the same day of surgery. This is a patient the night of surgery in his hotel, nightgown, ready to go to bed. Since they go home the same day, they enjoy the comfort of their own bed. This is the next day. Our physical therapy team visits the patients at home and ensures that they continue to do well and performing the correct exercises. This is a patient who flew from Saudi Arabia to have his knee surgery done here, and hours after surgery, he's being discharged.
Waving goodbye.
Yes,
So long.
he's actually walking to his
That's
car here.
amazing.
Now, how do you do follow-up with people who come here all the way from
Yeah,
Dubai?
from, like Riyadh, yeah.
Yeah, exactly. So a lot of it is done through the internet. They send me pictures, they get x-rays done there, and I talk to them. And now with,
Do a little Skype.
Exactly, with the social media, it's very easy to basically see how they're doing, and we're in very close contact. Unfortunately, they don't need much, these patients, because they heal in 2 to 3 weeks.
Yeah.
Well, that's some good bedside manner, too.
Well, and global medicine is such a 21st century thing. I mean, this is just a reality that you can consult with people from all around the world.
Exactly, that's very true.
Yeah.
So cool. Well, we're excited to have you here in Central Illinois and
Thank you very much.
bringing
It's
this
good to be here.
procedure to folks here.
How can people get in contact with you?
Well, Christie Clinic, I mean, we have our website. I'm happy to share it, and I'm one of the surgeons at Christie Clinic. I do my surgeries at Sarah Bush Lincoln Hospital, so
All right. Well,
That's
Google my name.
we know all those websites, which we will
Exactly.
connect our friends with at
you very much.
CILiving.tv. Thank you so much.
Awesome.
Dr.
Thank you.
Sartawi, thank you, and good luck with everything.
Thank
This is
you.
Yeah.
really cool. Yeah.
Tell our friends in Dubai to watch CI Living.